So given that this is your profession and your lane, let's talk about Dr. Kevin O'Connor, who in February of 2024 gave the last full clean bill of health for Joe Biden so that he could launch directly into a presidential run. Was this malpractice? What's your assessment here?
Well, I think he chose his words very carefully. He said he's suited for the position, something like that, which how do you even, we don't have a set of criteria for the presidency, and maybe we should. Maybe there should be cognitive assessments. Maybe there should be physical assessments, because we are living a long time. We certainly have it in my profession. You get referred out if you get too old to be practicing medicine. That's what happens in a profession where there's a lot of responsibility. People monitor it and call it out when they're having dysfunction. There's no such thing for the President of the United States.
Yeah, you wouldn't want to get on an airplane that was being flown by somebody with Joe Biden's diagnosis, like with his sets of symptoms, right?
You wouldn't want him as your lawyer, your doctor, your airline pilot. You wouldn't want him as the President of the United States. And my suspicion is that the people around him didn't want it either and stepped in and started doing the governing themselves. This is a scandal, and we don't know the full extent of it yet.
Doctor, given your deep expertise on prostate cancer specifically, can you talk us through when it was likely that they knew that Joe Biden had prostate cancer, and what will be the likely result of this diagnosis?
So it's what normally happens is you follow the PSA and it starts to pop up. You go, hey, let's do an ultrasound of your prostate. Oop, look, we see something there. Let's biopsy it. And if you have a Gleason 6 or less, you might just observe it. Those are not aggressive tumors. You're eventually going to need some kind of treatment. And if the grade and the size starts going up with future biopsies, it's called active surveillance, then you jump in. Somebody Joe Biden's age, you probably would do something like external beam radiation or perhaps radium implants. You wouldn't necessarily go to a prostatectomy. Now, did they do that and it progressed anyway? I don't know. Or did they observe it and whoops, it got away from us because it turned aggressive. We weren't prepared for it. I don't know what happened, but it didn't happen the way they said it did. Listen, I don't want to accuse anybody of lying. I wasn't there. I didn't examine the patient. But the fact is, I've never seen a situation, I've treated a lot of prostate cancer where you go, I feel a nodule. And again, that already is suspicious because you're going to be responding to the PSA before you worry about nodules. But what was the PSA? When did it start climbing? Those sorts of things. And my bet is it was 2 to 3 years ago. That's my bet. And if you look at Joe Biden's decline, it kind of accelerated about 2 years ago. So you have to wonder, I wondered if he was getting treatment for his Parkinson's disease and that was affecting his cognition. That's another layer of intrigue in this story. But now it's starting to look like, well, maybe they knew it was metastatic disease and they started to put him on androgen deprivation therapy back then, which would be the normal progression of things. Now, the physician you had on before, I could tell, doesn't treat prostate cancer now and isn't involved in current research. These days, you can actually send radioisotopes to each individual prostate cancer cell. And that's the way you would treat somebody like a president. But there's no talk of that. I don't know what they're doing. Has he not progressed? They're not telling us anything. And there's an interesting question in here. To what extent does someone who's responsible for leading the free world have an obligation to tell us about his own individual private medical conditions? What is that obligation? And people are not having this conversation. It's an important one to have.
Yes, it seems like something that is constitutionally mandated in a republic where the change of the guard would then go immediately to the vice president. There's succession here. If Joe Biden has a terminal, as our last guest put it, I'm not sure if would you agree with that?
100%. It's not a curable disease. Even with some of the fancier stuff I was describing, the cancer is brilliant. It comes back. It finds a way to push through that. And so, yeah, it is at this stage of history. Although one day we look to curing it, at this stage, certainly terminal at 5 years from onset of metastatic disease, which we don't know when that moment was.
So, forgive me for losing it here, doctor, but that is important material information that the president has terminal cancer.
Yes.
They were running him for president putting him up for debates, having him taunt Trump, say, make my day, pal, while he has terminal cancer? This is insanity, Doctor.
It's insanity. I agree with you. And that is why I'm using the word scandal. This is scandalous. And it goes right at the heart of, like I said, I woke up this morning thinking every journalist that was gaslighting us, that was telling us nothing to see here, sharp as a tack, photographic memory, every one of you should wake up this morning, and there's a lot of them out there, and apologize.
Because the flag still stands for freedom, and they can't take that